From the station that's on your side, this is Channel 7 News Daybreak.
The time now is 6:23. Not only do we feel better after a good night's sleep, but you may be doing your heart a favor. A new study says healthy sleep patterns were associated with about a third reduced risk for heart disease and stroke. Joining us this morning to explain is Baptist Health cardiologist Dr. Scott Davis. Good morning to you. Good to see you, as always. This is important to us because
you get plenty of sleep,
our sleep schedule is terrible, so we know there's lots of problems. Yeah, we can't talk about ourselves on this one, but for people that are watching out there, it's so important. We know sleep is important.
Yeah, so interesting study just came out in the European Heart Journal, and let me back up. It's important to know that, look, we're finding more and more research data connecting heart disease and sleep, right? We know about sleep apnea and rhythm disturbances. This is a study that looked at risk for heart attack and heart disease and stroke and sleep patterns. The study looked at over 380,000 patients that had never been diagnosed with any type of heart disease, no history of stroke, and ages from 37 to 73, so a pretty broad range of folk.
Yeah.
And looked at them for over 8 years. And what they did is they created a sleep score, and there was 5 different categories for a sleep score. Did you sleep 7 to 8 hours a night? Were you more of an early riser versus a night owl? Were you troubled by insomnia? In other words, if you're in bed 8 hours but you're not sleeping, that's not quality sleep.
Right.
Do you snore while you're sleeping? So there are potentials for disruption. And then they looked at all these 5 different categories. They gave you a score, and folks that scored in all 5 categories then had a 34% reduction in risk compared to people that had like 0 to 1. Now, this was an association. This was a relationship that they noticed. They're not sure about the causality, but again, it underscores more effort to look at sleep patterns and their role in heart disease and the prevention of heart disease. And then the other interesting thing they did was they looked at genetic predisposition. They kind of put you in 3 different buckets: high, moderate, or low risk. And so even folks that had low risk heart risk, but if your sleep pattern was poor, then those that had high risk but then a better sleep pattern actually scored better and had lower risk.
As a cardiologist, when your patients come and talk to you about risks and that sort of thing, is sleep something you're prescribing now?
Well, no, and it's not that. Well, the answer is this kind of then peels back another layer of the onion as far as looking at folks' risk. I mean, when we break down the traditional risk factors of smoking and diabetes and high cholesterol and high blood pressure, now we need to start to weave into that conversation. All right, you would be benefited by looking at your sleep pattern and trying to make it more beneficial and helpful.
All right, so make sure you're trying to get the best night's sleep, which is hard, but there are some ways to improve that.
Oh, absolutely. And look, if you need to look at setting your clock a little bit earlier, go to bed a little bit earlier, and then early risers benefit. So early to, like your grandmother used to say.
Yeah, get on up.
That's right.
Join us on Daybreak. We'd love to have you. We're helping you out with your health there. Dr. Scott Davis, thanks as always. If you have a question, you can call the Baptist Health Healthline at 1-888-BAPTIST.